Good afternoon, everyone, and welcome to the second event on the topic of leadership in early childhood systems on ECOS Institute, a platform for learning, for thought leadership, community building for the early childhood field. We are glad that you joined us, and we invite you to use the caption function to use the language of your preference throughout the event. Before starting, I will invite you to reflect together. The children and families who need the most support are often asked to navigate the most complicated systems. A parent may need to talk with an educator, a social worker, a health professional, a local authority, each working with the best intentions, but not always together. The result is a paradox. The families facing the greatest barriers are often expected to do the most coordination themselves. So today is not a discussion simply about leadership in early childhood. It's about whether our systems are organized around institutions or around children and families. And if we really and truly want inclusive early childhood systems, the question is, what kind of leadership is needed to bridge those gaps? I am delighted to welcome you to this conversation, and I will invite Géraldine Libreau, Policy Officer on Early Childhood Education and Care at the European Commission, and the Chair of the Working Group on Early Childhood Education and Care, to take the floor and be a host of our conversation today. Géraldine, the floor is yours.
Thank you very much, Mihaela. Yes, so very pleased to welcome you to this webinar where we will be discussing one topic that we have been discussing with the working group over the past 2 years. And if I could ask my colleagues to put on the couple of slides I wanted to share with you. Just to explain briefly what the European Working Group on Early Childhood Education and Care is. This is really something that is helping the cooperation between stakeholders to enable the policymakers and the stakeholders to improve the systems of early childhood education and care throughout Europe. I cannot see my slides, but hopefully you can. So just to explain, if we can go to the next one, please. Who is in this working group? So first, the context. In 2019, there was a council recommendation which was adopted on high-quality ECEC systems. And the idea was to help the member states of the European Union to improve the quality of early childhood education and care. And for that, there was an agreement on the EU quality framework for ECEC, which is made of 5 pillars: access to ECEC, qualifications, training and support to staff, existence of a curriculum, and then good monitoring and evaluation systems and adequate governance systems and levels of funding. So we've been discussing over the past years on these various aspects, and over the past 2 years, we've had a focus on leadership. We can go to the next slide, please. So over 2 years, we discussed everything we could about early childhood leadership. In this group, we wanted to have as many people as possible who represented different fields. So we had national representatives from the ministries which organize the early childhood education and care systems from all European countries. We also had European international agencies and institutions who represent some research expertise. And we also had stakeholders, because we always want to take on board the voice of the staff, the voice of children, and anyone who is interested in the field. So together, we bring our expertise, we define the questions which we need to reflect on. We meet quite a lot. We look at research, and then we discuss and produce some reports which we can share with you. And today we will be focusing on leadership. If I can have the next slide, please. Just to mention very briefly that over the past 2 years, we have published 3 thematic reports. The first one on models and practices in Europe of leadership. The second one on competencies and training, which proposes a competence profile for ECEC leaders. And then the third report, which will be the focus really of our discussion today, Leadership for Inclusion, Building Capacity, to strengthen a whole system approach to early childhood education and development. So taking a holistic approach. We also published a reflection tool for local policymakers to reflect on how to organize leadership in ECEC. And we had some peer learning activities in Germany, Luxembourg, and Iceland. And you can read the summaries of all our activities and all the exchanges that we had. So we're trying to share as much as we can. You have the link here where you can find all the report. Take your time to read everything because there's a lot to read. It's very rich, but I hope this is also useful in your work. So for today, we'll be focusing on leadership for inclusion, and we are very lucky to have with us Arianna Lazzari from the University of Bologna. Arianna has been supporting the work of the working group over the last few years, and she is the main author of the report on leadership for inclusion. So she will tell us today, to launch the discussion, why leadership is so vital for enabling inclusion. And we can close the slides. Thank you. Arianna, the floor is yours.
Thank you, Géraldine, and welcome to everyone attending this seminar. As I was supporting the working group as a researcher, I will start my contribution as from the point of view of a researcher. So, from sharing with you what research tells us. Research tells us that attending early childhood education and care services of high quality since the early years of a child's life can significantly contribute to promote their development, learning, socialization, and well-being. Also, research tells us that early attendance of ECEC services of high quality is beneficial not only for children, but also for their families. By participating in ECEC, parents are supported in their educational role through an everyday exchange with professionals. Moreover, attending ECEC services can facilitate informal exchange and free confrontation among parents, thus becoming important sites for creating peer support network. Having the opportunity to attend a quality ECC is beneficial thus for all children and family, but especially for those children and families who are experiencing disadvantage or who are at risk of poverty and social exclusion. However, if we look at existing data, research also tells us that children and families who are at risk of poverty and social exclusion are often underrepresented in early childhood education and care services. The monitoring of national child guarantee initiatives, for example, which is an initiative aimed at ensure that every child in need has access to essential services such as healthcare, education, and adequate nutrition. So the monitoring of these initiatives reveal that persistent equity gap exists. If we look at early childhood education and care attendance, for example, the data derived from the monitoring reveal that only 24% of children under 3 who are at risk of poverty and social exclusion have access to educational services. In comparison, 44% of children under 3 who are not at risk of poverty and social exclusion are attending ECEC services on a regular basis. This data clearly shows that early childhood education and care services are harder to access for children and families living in disadvantaged conditions due to multiple barriers that they encountering in navigating a complex system. This barrier can be related, for example, to bureaucratic procedures, to language barrier, but also relate to invisible barriers, such as, for example, fear of stigmatization or exclusion. The report produced by the working group suggests that a shift of perspective is needed in order to overcome this barrier to participation. As Mihaela said earlier, the responsibility for navigating complex systems, including ECEC, social and health services, cannot be placed on the shoulder of families who are already experiencing multiple disadvantages. Rather, such responsibility for connecting educational, social, and health intervention should be taken over at system level by creating collaborative networks among leaders who are coordinating such services within local community. Thus, we can say that truly inclusive services require leadership to be played out beyond individual setting in a systemic perspective that connects services for children and family across different sectors. In a context of fragmented service provision, the most vulnerable families will be always falling in between the cracks of the system, with the consequence of not having access to essential services they are entitled to. So, as family at risk of poverty and social exclusion cannot be left alone in navigating complex system, where educational, social, and health services traditionally operate in silos, a shift of perspective is needed. We need to move away from an institutional logic where families are expected to adapt to existing services. And we need to move toward a whole system approach where educational, social, and health intervention are tailored to address the multidimensional and diversified need of children and families living in complex conditions. Within a whole system approach, the responsibility for cross-sectoral collaboration lays in the hand of policy decision makers, who are responsible for the governance of services at regional, local, or national level. But also, responsibility for cross-sectoral collaboration lay in the hand of service leaders, who are responsible for facilitating interinstitutional collaboration within multi-professional teams. To put it more simply, when we are looking at the existing service provision for young children and family in our community, we should ask ourselves 3 questions. What are the barriers preventing vulnerable families to access essential services? What can be done in our capacity of policymakers or leaders to remove this barrier? In which way space and time for cross-sectoral collaboration can be created so that our community can become a nurturing environment where all children and family can thrive? In answering this question, we need to be aware of the obstacles that are currently preventing this shift of perspective to take place, because of course, the ambition of our report is to facilitate a shift of perspective, but we're also aware that there are many obstacles to it. A first barrier is related to governance silos. ECC, health, and social services often operate under different ministry or department with different rules and regulation concerning access and provision. Moreover, policies are developed and implemented at multiple levels, national level, regional level, local level, with significant authority often residing in the local level of governance. Coordination across governance level as well as coordination across sector at local level are both critical but very often lacking. A second barrier is inadequate and unstable funding to build leadership capacity over time. Public investment in services for young children and their family are generally lower compared to formal education sector or to other welfare intervention. Moreover, flexible funding models allowing an integrating approach to child and family support can be difficult to implement due to a reluctance to shift from traditional models of service provision to a more innovative and flexible model of service provision. Preventive family support programs often suffer from targeted and unstable funding. Short-term and project-based funding hinder leadership capacity building for cross-sectoral collaboration to become sustainable over time. And there's a third barrier to cross-sectoral collaborative leadership that is connected to rigidly defined professional culture and practice. Different statuses and languages used by professionals from various sectors can create barriers toward the development of a shared understanding of complex problems. And giving meaning to complex problems means also finding shared solution for complex problems. Leaders often lack of adequate initial and in-service training support in fostering interprofessional collaboration in multidisciplinary teams. And this make it even more difficult to create a shared working language across different professional sector. However, we also need to be mindful that tackling these barriers is possible. And in many cases, collaborative initiatives at political level and at institutional level have been already successfully undertaken. So I leave the floor to Géraldine, who will then introduce the next session where some of such initiatives will be discussed. Thank you.
Thanks a lot, Diana, for this interesting introduction. So this was really some of the aspects that we have discussed in our working group. The key findings of the working group's report on leadership for inclusion are available in the report, and the link to the report will be posted in the chat, so you can access it and read it fully. So thank you very much. I'd like now to move on to the next part of our event. So we have invited 4 guests to share their perspectives on supporting cross-sectoral collaboration. Now I'm very happy to welcome Carmen Lița from Romania, who is the director and the founder of the Step by Step Center for Education and Professional Development. We are also welcoming Sandra Fischer from Germany. She is a research associate at the Research Unit for Diversity and Education at the Institute of Political Science at the University of Bonn. We are also welcoming Anne Lambrecht from Belgium. Anne is the founder and the coordinator of Elmer, a very famous daycare center, an NGO which organizes daycare in Brussels through 4 branches in underprivileged areas of the Brussels region. And finally, we have Matthias Urban, Desmond Chair of Early Childhood Education and Director of the Early Childhood Research Centre at Dublin City University in Ireland. And I should also add that Matthias was a member of the European Working Group for ECEC over the past years. So also thank you, Matthias, for being here and for all the invaluable inputs you've given to the working group over the past few years. So many thanks to all of you for being with us today. I would like to start the discussion with the first round of questions to each of you. What kind of leadership and context is needed to support cross-sector collaboration? And what are the challenges, in your opinion? So I will start by asking Carmen from Romania. Carmen, I know that you have been using the Primo Keys approach, which ESA is supporting, which is a methodology to help local governments build integrated, high-quality early childhood services. It does so by focusing on coordinating health, social care, and education sectors to ensure holistic support to children and families. So based on your experience, what kind of leadership and context is needed to support cross-sector collaboration? Carmen.
Thank you very much, Géraldine. Good afternoon, everybody. I would start by adding that Primo Kids is an evidence-based program which was developed by the Jacobs Foundation and which we implemented in Romania between 2018 and 2022 in partnership with ESA and UNICEF. And the program is indeed designed to improve access to high-quality early childhood education and development services. The approach contributed to creating a coordinated leadership model in Romania for integrated early childhood services by placing the local governments at the center of the process, which was a totally new approach and concept for our country. Local governments took from the very beginning the ownership of the process in all 22 communities participating in the program, by mandating a structured approach to the cross-sectoral collaboration and political buy-in. Through the collaborative leadership across sectors of education, health, and social protection, and governance levels, we brought at the same table professionals from all three sectors, education, health, and social protection, together with the decision makers at local level and the other stakeholders in the communities, parents, business community, and non-governmental organizations who were active in the three fields. Altogether, they dived into the reality of their communities, aligned in a shared vision related to early childhood education and development through a data-informed situation analysis. All these things were very new to the local decision-making and the processes at local level in Romania at that time. The general context in Romania was that early childhood education and development was recognized as a priority at national level as a result of many years of advocacy. Effective network leadership, which embraced both a collaborative, distributed, and inclusive approach, was essential to move these processes forward at local level in all 22 communities, and also to develop the cross-sector agreement upon the short, medium, and long-term objectives of the local strategies that they developed as a result of the process. One other objective was to nurture the integrated work across the services, to mediate across the organizations and the different professions and different status that the people involved in the process had beyond the traditional top-down approach. The challenges related mostly to changing the traditional organization and work habits throughout the three sectors, to work in silos, in separate groups. The COVID pandemic was a huge challenge that changed the process, changed the approach, changed everybody's life, but also was an opportunity to increase the importance of early childhood services at the community level as a response to the needs of the families. Another one was related to the professionals working in the early childhood education and development services, where we delivered several in-service trainings for the professionals in the three fields together, trainings that targeted all aspects of child development and well-being for the first time in Romania. Another important challenge was related to the complexity of the situations in which the families in the communities were, and they needed to be addressed, as well as the diversity of problems that were identified through the situation analysis process, and which made the local authorities aware of all the challenges that they were facing. And also, all these situations needed to be prioritized and budgeted, given the fact that focus was not only on one field, but all the fields altogether, looking at all the services in the community that were dedicated to young children and families, from creches to crosswalks, from playgrounds for children under 3 to medical offices, from pediatric emergency services to complementary early childhood education and development services. For all this, collaborative leadership across sectors was essential and determined an irreversible paradigm mentality shift at the local level. Thank you very much.
Thanks a lot, Carmen, for sharing your experience. I will now turn to Sandra, who is from Germany, where the family centers have recently been developed. And the aim is to provide a one-stop shop for information and services to families. This sounds like a really exciting but challenging opportunity. So, Sandra, in your opinion, how can the leadership make it work? And what are the enabling conditions for these family centers to work?
Mm-hmm.
Yeah, thank you, Geraldine, and thank you to all of you for the invitation. I'm really pleased to be here with you today. Before I begin, let me briefly set the scene and provide some context on family centers. In my remarks, I will be referring to family centers in North Rhine-Westphalia. Why is that? First, North Rhine-Westphalia was the first state to develop ECEC centers into family centers in 2006. Second, in 2007, family centers were included in the North Rhine-Westphalia Children's Education Act. And third, with this legal inclusion, financial support was also provided. Since 2020, this amounts to approximately 20,000 euros a year. And last but not least, a prerequisite for funding is certification through an externally awarded quality seal, which is valid for 4 years. In terms of leadership, at least political leadership, the state government at the time, interestingly, a coalition of Christian Democrats and liberals, took over leadership from an originally grassroots movement and aimed to systematically develop family centers across the state. So today, a little more than 1/3 of ECEC centers operate as family centers, which means a relatively comprehensive infrastructure in North Rhine-Westphalia. And I think maybe comparable to what we just heard about Romania, it was because there was a general agreement in the government that it is important to provide early support, do prevention, ease the everyday burden on families, but also bundle services in the name of efficiency. This is important insofar as, in my view, one of the key success factors for cross-sectoral collaboration is ensuring sustainability through both legal and financial support. And this is a question of political leadership, I would say. There are 3 legally defined tasks or guiding principles for family centers: a focus on families, on cooperation with external partners, and on neighborhood orientation. And this leads me to one of the key challenges. In an evaluation of family centers in North Rhine-Westphalia in 2018, leaders of 36 family centers were interviewed. I was not part of this evaluation. I simply referred to it. And for these leaders, a key factor in leadership is time, because in addition to the classic or traditional ECEC management tasks, family center leaders are assigned additional responsibilities, primarily related to service coordination and the establishment and maintenance of collaborations. However, the amount of time available specifically for these leadership tasks depends on the nonprofit provider one is working for, as providers have a degree of discretion on how to allocate the annual 20,000 euros funding. So this results in a highly diverse situation across North Rhine-Westphalia, with some leaders having enough time or a bit more time for collaboration, and others having that are not able to rely on that. The evaluation also reveals another challenge, which with regard to cross-sectoral cooperation at the local level, and especially between the child and youth welfare system, represented by the family center on the one hand, and particularly the healthcare sector, represented by individual therapists on the other. If a family center wants to enable children to receive individual therapies on its premises, several obstacles arise. These include concerns from health insurance providers about creating demand, difficulties in billing procedures, since therapies provided on site are classified as home visits and therefore more costly, as well as skepticism among medical and therapeutic associations regarding suboptimal spatial conditions and potential competition between service providers. Overall, I think the main challenge for cross-sector collaboration lies in moving beyond the local level and individual actors, such as family center leaders or therapists who would like to work on site, towards a broader perspective that takes into account different regulatory frameworks, financing systems, and professional logics. And I will leave it at that for now, as I may come back to this point later. Thank you.
Thank you so much, Sandra. I'm always stunned by how the devil is in the details when you start talking about the insurance problems and how that can get in the way of such beautiful initiatives. But also, I think it's interesting to note that there is a need for political leadership to ensure the development of such initiatives. We really need to have the national or regional power supporting such initiatives. But then again, equally important, I believe, are the grassroots initiatives and leadership by committed local leaders. And this is now why I moved to Anne in Belgium. And you are leading the Elmer network of daycare centers that also organizes a family center as an integrated services. So I would also like to ask you the same question as to our first two speakers. What kind of leadership and context do you think can make possible the cross-sector collaboration? And
good afternoon, everybody. So first of all, my experience is that often practitioners are really willing to work together. But still collaboration in practice, and especially the cross-sectoral collaboration is often still not running smoothly. And if you go to analyze this and look for the causes, then we in our practice, we came on the higher level of the politics of the policy, where we see that there when there were trials to work on cross-sector collaboration, that there was no or not enough coordination on the policy level, and that gives them difficulties on the field, let's say. Another thing that we experience is that on policy level, often there are unrealistic expectations of cross-sectoral collaboration. So sometimes it is seen as a wonder solution. If service would work better together, then there will be more capacity. But we think that is not the case. We think that first of all, there has to be enough capacity at the service level, and then if there is enough capacity, you can start working together and working cross-sector together. So that is one thing that we see, and another thing that we see is that collaboration is often expected on the field, but that the conditions are not created. So there is no time, and time is always to be understood as funding to organize or to lead collaboration. So I think what we as practitioners need is that there would be a role or a mandate installed to be able to work together across sectors, and also that there would be funding for that. So the challenges, I see three challenges. One is that first of all, the cross-sectoral collaboration should be organized on the policy level. And Ariana already mentioned about ministers. So I think it's really important that we would have one minister of the child. If you look at Flanders, we have the Minister of Welfare, who is responsible for the children from 0 to 3. Then the Minister of Education is for 3 till 25. And then there is also a Minister of Youth. So 3 different ministers, often different political parties, and that's what we feel on the field, that it's really not integrated, and that integration is difficult at that level. But also, I think a stronger directories from the higher level, the European level, then would be nice. As I feel often it's there are a lot of recommendations and advices, but there should be more obligations. And then I think if it comes from that level, it will come down, and the service level will collaborate more smoothly together. So that's one challenge, I think. Another, the second challenge that I see is that it would be good to create more ECED services with hybrid structures. I could read it in a report on interprofessional collaboration, and also Professor Pauline Slot in Holland made research on it. But we see it also in our practice in Elmer. We are a hybrid structure of EC services, family center, in a center for inclusive childcare, and also practice center for learning and working, for side entrance to come into our sector. And we see that it's really having all those services in the same institution results in more inclusive and multidisciplinary approaches, where there is a more naturally integrated leadership, and that is an important thing. We also see that it helps really to improve the accessibility of the service and also the quality. So those hybrid structures would really, we think it would be really good. And then a third thing, maybe it is a repetition, but I think there still needs to be investment in the development of leadership competencies. I think there is on an institutional level, we see there is really room for further professionalization on that matter. Thank you.
Yes, thanks a lot. And I think indeed you spoke earlier on about formalizing the mandate and really make cross-sectoral cooperation fully recognized. I think this is really important because usually we see a lot of goodwill from people, but it's not always recognized as much as it could be. And sometimes it feels a bit unfair to people put so much effort into things and it's not fully recognized. So that could already be an enabler. Thanks a lot for your input. Now we'll move to Matthias, and we'd like to hear from the researcher perspective. So Matthias, you have ample knowledge of ECEC systems across the world, and you must have seen some systems that work efficiently to support vulnerable children and families. So what would you say are the challenges to develop cross-sectoral collaboration, and what kind of leadership or enablers can make it a reality?
Right. I think it was one of the main characters in Umberto Eco's novel, Foucault's Pendulum, Casaubon, who famously said, "To every complex problem, there's a simple solution," and it is wrong. So I suppose this is what we're talking about. I'm going to sort of try and approach the systemic conditions for the kind of coordination and integration that we're talking about here from three different angles. One is to talk about systemic conditions. The second one is the role of professional or systemic competence. And finally, third, just a thought about the role of research in all this. So I'm thinking, when I listened to the three presentations previously, I think some points come across already, which is not the importance of coordination. And I would like to emphasize that and underscore it, that one of the critical factors for cross-sector collaboration to work is high-level coordination and leadership. By high level, I mean really high level. I mean something that is organized at as a priority at top level of government. And it might mean, and we have some examples from countries around the world, that it is not just about an ambition to bring different departments and ministries together, but to actually create a new structure that takes away responsibilities from departments, brings them together. So high-level coordination, or highest level coordination and leadership, I think, is one of the critical factors. And that, of course, requires resources and conditions. And one of the conditions or factors of success, I think, connected to that would be a secure multi-annual resourcing of the coordination. I think one of the tricky issues is not we run from one annual budget to the next. Multi-annual resourcing and ideally an integrated budget for this coordination rather than ending up in constant negotiations between different ministries and departments about who contributes what. For this to happen, I suppose there are several factors that are helpful. One, I suppose, would be to clearly demonstrate at the highest level a direction of travel, and that might mean moving from ambition or strategy to legislation, which makes a lot of things easier, including the resourcing and the multi-annual budgeting. So we're talking about a rights-based approach to cross-sector collaboration, and we're talking about a legally framed approach to this. Another aspect of systemic conditions that I think we can see in successful examples is the replication of the coordination structures at national level at every single level of state. So from the national to the territorial or state level in federal states, to the level of local authorities and the municipalities. The reason for that is that policy priorities develop and change at various levels, but if you have things established at the various levels of government, even if national policy priorities change, it becomes much more difficult to undo things at the local level if they're embedded. Accountability is a very important aspect of creating systemic conditions. Accountability, evaluation, feedback loops that actually learn from local experiences and feed them back into the higher level policy making process. So, and if we look at this from sort of an international perspective, then it also takes us to an issue that I think we have when it comes to sort of high level documentation and reporting. We still have quite an obsession with looking at states when it comes to global reports, for instance, as published by UNESCO and others. And we still don't have enough focus on what's happening at the local and the subnational level. And we know that when we talk about the situation, experiences for children and families in countries, that there is a huge inequalities, not just between countries, but within countries. So I think the lens on the subnational level, and we do have some excellent work in this space already. I'm just thinking of the work of people like Alejandra Cardini and Carolina Semeloni in South America, who really focus on that. So that's sort of the outline for systemic conditions. It does have implications if we take the question of rights-based legal frameworks, if we take that seriously, that has implications, I would suggest, also for, let's say, the international finance architecture around that, because it would help reorient funding strategies of major funders for early childhood development towards the realization of public policy and away from funding separate programs and priorities. So I think this is something that's really important to establish. Second, let's come to the role of systemic competence. And I suppose there is something that we can do within the early childhood world. We do know that we have highly qualified early childhood professionals in many countries, but we also know that they are very much they're much better qualified when it comes to the immediate work with children. And there is still a lot of work to do in many initial professional preparation programs in terms of working with families and understanding how systems work, in understanding how policy works, how policy is created. And I think this level of systemic competence is quite often absent from our initial professional preparation programs. Something was mentioned already by Ariana, is the question of misunderstandings and understandings, professional languages, professional cultures. And that is a well-documented experience, for instance, in the UK Sure Start Children's Centres over years, that it's not enough to have a group of well-meaning, highly qualified professionals in one room. They all might talk about the best interest of the child, but the question, what exactly does that mean when you come from a health perspective, from an education perspective, from a social welfare perspective? And that requires forums for developing a shared language or for shared understanding, because there are very different ways of knowing, doing, and being in our different professions that we need to coordinate. So that is something that can be initiated at local level. It can be initiated by educator and teacher training in universities or education, but it also needs resourcing. It doesn't just happen. It is something that actually needs to be built into the system. And of course, there is a question about hierarchies, power, differentials between different professions, or reputational differentials in terms of the medical profession, the psychologist, the educator, the glorified babysitter. So there is something not just about sort of bringing people together, but there is some work that we have to do in terms of the self-image of who we are as early childhood educators in that. And that brings me to my third point and final point in this.
Matthias, can you please wrap up?
I know, I'm doing this now. The role of research. And I suppose what I would like to suggest here is that early childhood education and care, as we have it, looks a bit like a donut. So we have this ring where all sorts of different disciplines and professions have a lot to say about what good practice means in this field. We have developmental psychologists, we have economists, we have educators, we have the health professions. But what we have in the middle is a hole. There is a complete absence of a field-generated, integrated theory of early childhood. And I think there's some work that we have to do here so we can actually speak with competence in this context. Thanks.
Thank you, Matthias. So indeed, loads of ideas and pointers for developing this. I just take this opportunity to tell you that the ECOS Institute always provides a very good summary after the webinars that are recorded. So you can come back to all these ideas also afterwards. So now I'd like to move to a second round of questions for all of you. We've talked about national frameworks, we've talked about local flexibility, local leadership. How do we reconcile these two if we want to build integrated systems which support early childhood education and development? How can we find the right balance between these national frameworks and the need for local flexibility? We'll start with you again, Carmen, please.
Thank you very much. I will rely again on our experience in Primo Kids, where we learned that we can combine the two of them. When we started Primo Kids, we were in a point in time when we had an emerging national legal framework that was recognizing the importance of early childhood education and development. And we managed to reach a very high level of interest at the government level. While by implementing the Primo Kids, by initiating the situation analysis and the processes of developing the local strategies, the local decision makers were faced with the different realities in their communities, like not enough services for children under the age of 3, not enough qualified staff for delivering these services, and probably one of the most challenging situations that we were facing was that nurseries were not integrated with the education field. The cross-sectoral collaboration that we managed to develop as part of the implementing the Primo Kids, all the data that was used throughout the processes to inform the local situation analysis and the development of the local development strategy, and also the implementation plan and the associated budget, revealed to the local authorities and all the stakeholders that were around the table during the process the complexity of what the early childhood and education development services meant, and how looking together on how they can best cater the needs that they identified in their communities. Piloting all these processes, all the training sessions and the mentorship that we did to the professionals, for the professionals involved in the existing services, and for the services that we developed and we called at that time complementary services that address specific needs in specific communities, also informed the national policies. And not only that they informed the national policies, but we also managed to determine some changes in these national policies by developing new ones and rethinking the existing ones. And I will give you some examples. We managed to expand the legislation and the funding from the standard services that we used to have at that point in time, the nurseries, the creches, how we call them, and the preschools, to include complementary services, which were services that were addressing specific needs at local level that the standard services were not able to provide at that point in time. These were included in the national legislation that appeared at that time, and then they became part of the national education law that was developed in 2023, and also they had a budget line. And this was a process that not only used the results of the Primo Kids in the 22 communities, but it also was backed with a lot of advocacy activities and efforts. Also, as a result of the Primo Kids and the cross-sectoral collaboration, we managed to reframe the national in-service training, which was very siloed before the Primo Kids implementation, but based on the experience that we collected in the 22 communities, we managed to design a national program that includes professionals from all 3 sectors that go through a common training program in order to work in an early childhood service. Thank you very much.
Thanks a lot, Carmen. It's really interesting to see what a great achievement of developing such a national program. I think this is really the way to go, and Ariana might tell us a little bit also later. There's also been an integrated training of people working with children from 0 to 3 to 3 to 6. So it's a kind of different partnership, but clearly bringing people together to learn together is really a great way to foster collaboration. Thanks a lot for this example.
Thank you.
Now I'll pass the floor to Sandra. Again, based on your experience with the family centers, how can the national frameworks help and combine with the flexible of the local needs, flexibility of local needs?
As promised, I would like to come back to my example with the youth welfare system and the healthcare system, maybe also because I'm actually working on it and connecting to my colleagues here and what they said. I think I believe that the national level is of great importance. Also, of course, like in Europe, the European level, and there are also international frameworks who propose cross-sectoral collaboration in the youth sector, but also in the healthcare sector, thinking about, for example, the wide definition of what is health in the UN Health Convention. So or the health in all policies concept. So on the international and EU level, there are concepts talking about cross-sectoral collaboration, but at least in Germany, it is a bit more difficult to come to that point. So in Germany, the child youth welfare system is governed by the Social Code Book 8, and the healthcare system is governed by the Social Code Book 5. And with regard to the governance structures established by Book 8, the youth welfare system, one can say that it provides a strong foundation for cross-sectoral collaboration, also for preventive social policy, targeting children at risk of social exclusion. And this is because it combines universalism with a targeted approach or support. It places children's interest at the center. So the whole logic behind it is a holistic approach to individuals. And I think it fits that it's basically it's based on tax-based financing. So this also provides legitimacy for primary and structural prevention. In addition, the Social Code 8 works as a framework law, so it assigns coordination roles to the youth welfare ministries at the state level and to the youth welfare officers at the local level. So there are legal obligations for the youth welfare or for people working in youth welfare to cooperate with other sectors. However, when it comes to the healthcare sector, challenges arise, and they arise from the national level, trickling down to the micro level, the local level. And I think it is due to different governance logics, financing systems, and regulatory frameworks. So the financing architecture in healthcare in Germany is contribution-based funding. We have a very fragmented insurance landscape with a lot of private providers and also public providers. And this makes it difficult to design and implement a universal preventive service logic. And if there are preventive services, they are project-based, short-term, and structurally not integrated across policy fields. So it's not a multi-annual resource resourcing there in health. Moreover, the health sector is dominated by a lot of corporatist actors with specific interests, which poses obstacles to an understanding of health as part of an overarching prevention strategy. And at the local level with the family centers, it depends then on the leaders if they try to overcome these barriers and if they find the therapists who are not scared by the legal framework of healthcare to work together, or if they find ways going around these legal outlook, or if not. So there is no coherent picture then, because all the pressure is then on the individuals again on the local level. And even still, looking at the local level in Germany, the local level is notoriously underfunded because we have a very centralized tax system with all the money going to the national level, and then they distribute the money to the other levels. So I would say to balance a systematic and preventive social policy for children that goes beyond isolated examples of good practice and is coherent requires structurally anchored competencies at the local level that are linked to a stable financial resource or linked to stable financial resources. And this should be accompanied by structural reforms on the national level. For example, health-related prevention should be financed through taxation as well. And the cooperation obligations, which are found in the youth welfare system, should be also integrated into other policy fields in order to enable real cross-sector coordination, fostering professional exchange, and support mutual learning. Thank you.
Thanks a lot, Sandra. I was thinking when you want to break the silos, you really need a very strong hammer to break the walls of these silos. But I think the work you described in really analyzing in fine details where the problems are, and sometimes it's as stupid as the youth saying you should cooperate and the health not being told that they should cooperate, really it shows that sometimes you really need to identify where the problem is in a very fine, minute way. And I think this is important work you're doing. Thanks a lot for sharing this. I muted myself, sorry. Yeah, I wanted to ask you, Anne, how in Brussels you are managing to balance the limits and the regulations which are imposed by national frameworks with your local needs for flexibility.
Yeah, so in Elmhurst, so whenever we have the opportunity to participate in a pilot project or an innovative project, we take that opportunity so that we can experiment on a service level on how to cooperate, how to work with deregulation, how to search new ways for integrated working. So recently we had an experience in a pilot project called Care and Support. And that project departed from locally embedded family centers, so as we are in Schaerbeek in Brussels. And the aim was to form functional teams, cross-sectoral functional teams in order to collaborate in a more integrated way around the families. So we, in our family center, we used the ECEC tool to install this functional team. And we started with creating a document with our common ambition. So over the sectors, what is our ambition to work together and to be in this functional team? Then we worked on a shared understanding of target groups. Do we have the same understanding of who is our target group? What are the needs of those target groups? And then we worked on an action plan. But so what were the important conclusions? We are almost at the end of this pilot project. And so we two main things we see that this one thing what was missing was a mandate, was a clear role, a role with a mandate to organize the collaboration, because we saw that the colleagues from other services and sectors, they could choose to participate or not to, because it was on a voluntary basis. And so the commitment in this team was not binding. So it was really depending, as Sandra also, it was very recognizable what she was saying, because we see that it's then depending on individual persons who are involved, and so not structurally. And then not always the right persons are sitting at the table. So we think if you really want to work together around families, then it has to be the professionals themselves who are working with the families who should be at the table, and not professional networkers who are going from one table to another, but who don't know the families. So that was something that we noticed and was very important, something to take along. And another thing, precondition, very practical, was, and in ECEC they talk about systems and protocols on information sharing. So what we noticed in this project was that we lacked or we missed a shared registration system. So we really needed it to be able to work together around concrete families. So we think that that should be provided on the policy level, so that there would be funding, but also regulating, because the legislation on privacy is very difficult. So if you work together with people in the medical sector, people in different sectors, everybody can hide behind the privacy. So we have to work on how can we work together and talk about families and their problems together. So that is something that we learned. So my conclusion is that those projects with space to experiment are very good, but you have to install then also the preconditions, such as the mandate and shared registration system. But then the challenge is to translate what we've learned in that experiments into really structural systems. And so now in Flanders, they are trying now to, the policy is trying to translate that in the structures, and we hope we will find our findings and our recommendations in the new legislation that is coming for 2027. Thank you.
Thanks a lot, and that's a lot of practical and interesting ideas to really reflect on. You mentioned the Intercis project, so this was a project, a really excellent project, funded by the Erasmus Plus program. And if you look in the chat, you will have access to the toolkit, which has been produced by this project. It's already a few years old, but it's still very, very good. So I invite you all to have a look at this Intercis toolkit. Thanks a lot, Anne. Now, finally, Matthias, from your research and observations, would you have any recommendations to local policymakers or ECEC providers who need to deal with national frameworks and local realities?
Well, I suppose the big topic here is implementation of policies. And I suppose one of the things that a lot of people realize is something that has actually been documented in implementation research for quite a while. There is an ancient paper that is now more than 40 years old, where the authors traced sort of how implementation of high-level sort of national federal programs it was set in the US, how that sort of how the implementation works or doesn't work when it comes to the local level. And their key message really is to say nobody does what they're told ever. And I suppose that is one of the experiences that we seem to think that if we create these high-level systemic conditions that I talked about in the previous round, then we can sort of then move on to developing an implementation strategy and expect people to actually realize that at the local level. I suppose what we have to realize is that there is no such thing as implementation. There is always enactment and interpretation. So if I'm expected to work collaboratively in my local context with others, and that is part of national legislation, again, it's important to have legislation rather than a policy strategy, then of course I interpret what's expected of me based on my professional background, my own knowledge, my own priorities, my own biases, my own sort of preferences. So instead of trying to pretend that's not happening, I think one of the really important elements of such an integrated system is to actually qualify and support every single actor in this system in their interpretations, to actually make sure that they are recognized, that they are respected, but also that they are supported in making sense of what's actually sort of happening in the wider system. How do you do that? One of the sort of ways of doing that would be to turn that top-down implementation idea back on its feet, and to start with what do you actually expect to see happening on the ground locally in your community? And from there to actually then say, and what are the institutions, the structures, the mechanisms, the knowledge sharing instruments that we need to put into place to make that happen? Governance theory and implementation theory has a name for that. They call it backward mapping. But it's really sort of starting with what do you want to see actually? What's the change you want to see at local level? And I understand that projects like Primo Kids, for instance, are very well experienced in doing that. That also sort of links to an understanding that national frameworks have to provide for diversity of responses to local capabilities, to local needs, to local capacity, instead of expecting sort of a rollout of a one-size-fits-all program. This old idea of there's something that works, how can we upscale it? How can we bring it to scale? What we can bring to scale is the conditions for things to develop locally rather than and we do have some well-documented examples in fields around or next to early childhood education, for instance. There's a whole body of well-documented projects again in the US, but I'm sure we can find examples elsewhere as well, mainly in the public health environment, where sort of approaches of a sort of community-based intervention research are well documented and they work. And the main question here really is to figure out what would better outcomes for all children and families look here. So to say, actually go back to the capabilities, to the capacities, to the situations, to the needs. And again, I understand that Primo Kids is one of those examples where that actually happens. But then, of course, the question is, how do we move from this wonderful collection of local participatory processes into a coherent policy-making process at the wider level? And I suppose that is sort of where we need to pay a lot of attention to feedback loops, to evaluation, and build that into the system from the very beginning. So I suppose that's really what I think we can do here, and learn from examples. Yes, resource participatory action research and intervention approaches, but make sure that they don't exist in isolation, that you actually learn from them and feed that back into the policy-making process.
Thanks a lot, Matthias. Thanks to all of you for sharing your expertise, your ideas. And now we have a little challenge for you, the panelists, and also for the audience. So if my colleague from ECOS would like to share the slide, we've prepared a little case to reflect on, where we challenge you to use all your knowledge that you've had, that you've acquired over the past hour, to think about what you would do in that particular case. So let's imagine a municipality wants to improve outcomes for children in vulnerable situations. The education department, health services, social services, they all agree that better coordination is needed. A strategy has been written, meetings are taking place, and everyone is supportive. But 2 years later, families still navigate multiple systems, professionals rarely share information, and no joint action has materialized. If you were asked to intervene tomorrow, what would be the very first thing you would change to move from agreement to action? I will ask a 1-minute answer from each of our panelists, but I also invite you in the audience to post your answers in the chat, and then we will be looking at them. So who do I start with? I think I'll start with Matthias. Matthias, you have 2 minutes per panelist. 2 minutes.
Right. Okay. Everybody's on board. Everybody thinks it's a good idea. So my 1 minute answer would be look at your local coordination structure, and if there isn't one, put it in place immediately. Find and that could be more than just people sitting around the table. Find a local champion to actually drive the initiative, involve families not just as clients, but actually as decision makers, as owners of the project, and devise and communicate and publish a clear roadmap with steps towards where you're going.
Super, perfect, thank you. Carmen, how would you handle that?
Matthias has already mentioned some of the ideas, so I would only add that I would make sure that the local authority is involved, is aware of what is happening, and the political buy-in of the decision makers is there. I think the voice of the parents, not only as beneficiaries but as co-authors of the implementation plan, is very important. And I would also look at what is the kind of expertise that's missing from the local coordination structure or local action team, as we called it in Primo Kids, and I would add to it, and I would make sure that the strategy has an implementation plan with a budget associated. Thank you very much.
Perfect, thank you. Anne, how would you handle that?
So I would first, see if there is a step missing, namely the shared action plan with specific goals and actions and timing and also responsibilities, and also a system to follow up the actions would be put in place. And also create a forum, a meeting system with the participants, then the professionals working with the families, so that they are coming together, sitting together, and can talk about specific families. So that it would not only be words, but also be actions.
Okay, great. Sandra, what's your opinion?
I think basically all that I've written down was said already. The only point maybe would be internal trainings for the different parts of the local administration to get to a shared language and to take all people working in the administration with you on this way.
Thanks a lot. And Ariana, would you like to contribute? I think you've been working on such topics as well at the moment.
Yeah, exactly. With a multifunctional center that is a pilot project run by Save the Children in Italy at the moment. So I changed my jacket. I'm not a researcher anymore. I'm a trainer. And as a trainer, I think it would be very important to break down entrenched practice that very often are embedded in institutional and professional cultures. So very often people or professionals agree to collaborate on the surface, but then there is mistrust. So when we start the training, we also start from how can actually lower the barriers, how can break down the mistrust or reciprocal prejudice that exist among professionals from different fields, and creating a situation in which they can actually relate to each other practice, relate to each other way of understanding complex problems. So I would work on team building as capacity building strategy for interprofessional collaboration. In this project I was mentioning, we started from training and we ended up into developing an interinstitutional collaboration protocol, but the protocol was not developed at the very beginning, was actually the result of a process. So people didn't feel like they had to implement something coming from the bottom up, but rather they were involved in drafting themselves the interinstitutional protocol.
Wow, thank you all for your answers. I think together you make a magic team who is able to solve all of the problems that are posed here. I think we have quite a lot of interesting answers in the chat, and I hope Mihaela can walk us through the different ideas which have been suggested there. Mihaela.
Yes, I want to say actually it's not just the panelists that make a great team, but also our participants. I think that there are quite interesting ideas coming in. And some coming from Gwen was saying that I would introduce an AI-based app that connects all stakeholders around the case. Noting that it's a problem of communication, so not sharing the same information or not being actually on top of how the implementation is going, missing information actually about how the implementation is going. What it was mentioned that the absence of a feedback loop there. The question is how come that we get 2 years later to the same situation? It's the critical part actually in the process. The other suggestion was in Iceland, our colleague Björk actually was mentioning that every family has a right to a coordinator to help them navigate through the system. By assigning such a coordinator, it means that you would never get to the situation of not happening nothing in the 2 years' time, but actually there will not be such a not happening result. Chiara Piccolo is saying I would call a roundtable meeting requested by municipality with parents participating and being at the table so that they would agree on 3 main steps to be taken so that an action plan is put into place with a review in 1 year to check if actions have been taken. So I think it is a question of not having only a good plan, but also monitoring and being sure that the plan is appropriately implemented, and those that actually are benefiting from the implementation are part of the agreements and being part of the implementation itself. Actually, this is related to one of the questions that was asked earlier, where we talked a lot about the political buy-in, which obviously everybody agreed that it's either at the local level, but also at the national level that are critical. But the question was like how we are making sure that families are not left out from the decisions that are taken and the plans that are made. So it is kind of related with this case clinic that we proposed, especially if this becomes a political issue, is like belonging to a specific party. And then at the moment that the wind blows in a different direction, it becomes a political tool rather than a social issue that is to be collectively addressed. So I think this was an interesting question also to see to what extent integration becomes too political, or it is treated as a societal issue, another way of addressing social problems that are preventing development, not to say rights, kind of complying with the rights, but also to what the population deserves in the countries that they are living. So I just don't know if there is any reflection on this part.
I think there was also the idea of, in the chat, of having a kind of formal feedback process for families to reach officials. And it's true that sometimes giving the floor to families to react is also, it has to be organized.
Yes, exactly. So that you don't get to wait until 2 years' time to see if something happened. It's a too sterile implementation plan with not really looking or keeping an eye on how much it has been achieved through all the agreements. Otherwise, all the work has been almost useless.
Yeah. Before we go to our concluding words, do our panelists have anything to add to what was just discussed? Or any last bright idea? Just open your microphone and share.
Well, if I can, I just in terms of families, I think one thing that is really important when we talk about involving families to be very critical about who speaks and who's silenced in this process, to make sure that it's not the ones who are speaking the loudest or the ones who are always out there, but to actually make a very clear sort of examination of who's encouraged to speak, who speaks, and who's silenced in this, and think very hard about how to bring them maybe not to the table. Maybe the table is not the right place for them to speak.
That's a good point.
I would like to add, with regard to the parties, with regard to the family-centered system, there was like a cross-party coalition, because what the Christian Democrats and the Liberals did was, of course, also greeted by the Social Democrats and the Greens, and the subsequent government, Social Democratic Green government, didn't do anything. However, I would agree that we live in times nowadays with a lot of like right-wing populist parties on the rise, or even in government, and also like it's important to watch and to probably fight against these tendencies, because socioeconomic vulnerable families, but also diverse families, families with a migration background, might come under the wheels with right-wing populist parties on the rise.
Thanks, Sandra. I think we are reaching the end, and Mihaela has some concluding words to wrap up this very interesting webinar. Thanks a lot to our panelists for your inputs. Thanks.
Well, I have to say thank you also, Géraldine, and to also all speakers, but also to all participants for actively sharing also their valuable thoughts and reflections. It has been quite a rich discussion. I think that we all agree, and it should not end here. And we are going to tell you and promise you that actually it will not end. I think that if everyone agrees that integrated support for young children and families is needed, we are still asking ourselves, why is it so difficult to achieve? And I think that some of the answers have been given today. Maybe many are still to be said. However, it's obvious that it's not just a lack of evidence, and it's not a lack of commitment or good intentions. I think that even the examples that were presented today are showing that they are there. I think it is that integration asks us to think differently about leadership, about moving beyond leading individual services or projects or institutions towards leading relationships, partnerships, and systems. It requires perhaps creating shared purposes across sectors, building that type of trust between professions and professionals, and ensuring that children and families are remaining at the center of the decision-making. It is political leadership, but it's also policy leadership, but also moving from an aspiration to legal binding acts. And that's why I'm coming back to what Matthias was saying, because then I don't think that it matters anymore if the political parties are bouncing in terms of leading positions. So thank you once again, Ariana, Carmen, Sandra, Anne, Matthias, and Géraldine for sharing your expertise and your experience with us. I thank you all who joined us today from so different countries and contexts. You might not know, but we tell you, and you contributed to the chat. I'm saying that it doesn't end here, and it doesn't, because in this October, many of the themes that we have explored, we just started exploring today, will be further explored at the ESA conference in Lisbon, 22nd, 23rd of October. where we will address this complex issue of integration. We are really stuck to it for so many years, and we will continue supporting solutions that are coming to answer to this very complex issue of integration. But this conference will be a bit different. It's a solution co-construction-driven conference where all participants will be part of the deep discussions, bringing their experience and their expertise from implementation. And we will collectively consolidate the learnings that are coming. And hopefully after October, we will really learn more, because people are going to come, we already know from the contributions that have been submitted and from the participants that are registering, they are coming from all over the world. So things are happening. We just need to consolidate all this learning with evidence and practice-based experiences and how actually we are really moving the needle. But for you, and I think, and thank you for mentioning this, Géraldine, for that every event and every thought leadership event in ECOS has a summary. We're capturing it in our ECOS newsletter that we are really encouraging you to submit. It's not promotion, it's not just marketing. It's really sharing knowledge that sometimes not everybody has the time to participate, or we are landing in a wrong time in people's lives. So this is the way of keeping everybody involved in all the discussions. So please do so. Either subscribe to our newsletter, but also register for the conference if you're really interested on this topic. The ECOS Institute was created as a space for ongoing discussions, learning, and exchange. And I think that today's discussion has been an illustration of that and one step further in that journey. We thank you again, and we look forward to having you with us, if possible, next time. And again, many thanks to all of you. A really good afternoon. Whatever happens in the world, stay safe and healthy, and a bit of joy if possible. Thank you.